came from a family of physicians, and I always grew up assuming that I'd become a doctor. I went into radiation oncology because my older brother is a radiation oncologist, and he suggested I do an elective rotation. I liked it, and I went into the field. And then in the late 90s, I actually left for several years to work in a biotech startup, but I always kept my medical license, and I always kept seeing my follow-ups just to keep my hand in medicine. And when we sold the company, I had an opportunity to come back into medicine, which I took immediately, and I joined the faculty at Jefferson, and I've been there ever since. And clearly that's what I was meant to do. The most rewarding part about being a doctor in my field, I think, is trying to work with other specialists to bring a customized treatment plan to individual patients. And the idea behind that is to really maximize the benefit and minimize the side effects. And I practice clinical medicine, and there's really nothing better than a patient saying, thanks, doc, for helping me. I really appreciate it. It really doesn't get better than that. The one question that I wish patients would ask me more often is, how is my diagnosis going to affect the people who care about me, that are around me? A diagnosis of cancer is very complicated. It's very traumatic for everyone, and this is a very, very difficult territory to navigate. I am Dr. Scott Fisher. My mission at Jefferson is to improve lives.